Welcome to the Sage Women podcast, hosted by Melanie White and Dr. Nick Engera. We have real conversations with real women, health professionals, and coaches who share stories about perimenopause, menopause, and a range of women's health issues. Please subscribe so you get the latest updates every fortnight.
Hi, it's Melanie White on the Sage Women podcast, and today we are running a panel discussion to talk about some of the lifestyle interventions that are really essential for women in perimenopause and menopause, why they're important, and what we know according to current best practice. This is one of many areas that's a taboo topic, and by having these conversations, we really hope to shine the light on what's going on for women at this stage of life and what some things are that they can do to make their life and their symptoms better. And today I'm going to introduce our panel of 5 guests from the Sage team. Really excited to hear from each of them today. And starting off with some brief introductions, Claire, would you like to go first?
Thanks, Mel. Hi, everybody. My name's Claire Kelly. I'm a registered nurse turned health and wellness coach, and I specialise in cancer and also women's health and menopause.
Thanks, Claire. Lisa.
Hi, everyone. My name's Lisa Saunders, and I'm a nutritional food and health coach. And having a special interest in women's mental and nutritional health, particularly through the various phases of their midlife, ensuring that they thrive as they navigate these transitions.
Thanks. And Lydia.
Hi, everyone. I'm a medical doctor, a lifestyle medicine physician, and I have a special interest in supporting women through menopause, particularly helping them to age well. That's it.
That's what I'd like to do too, Lydia. So I'm looking forward to hearing from you today. Sharon.
Hi everyone. I'm Sharon Tompkins, and I'm a holistic leadership coach and also a registered personal trainer. So I've got a real special interest in health and fitness for women at midlife and what that means. So how do we adapt what we've been doing thus far to accommodate this new phase of life?
Thanks, Sharon. And Youna.
Hi, I'm Youna Angevin-Castro, and I'm a health and wellness coach with a special interest in supporting women in midlife with any sleep issues and more generally promoting better sleep for improved physical, mental and emotional well-being.
Thank you, ladies. We're so glad you're here. I'm looking forward to tapping into your wisdom and expertise and insights. I know that you've all worked with a lot of different sorts of clients and that you're bringing to the table not just your current evidence-based knowledge, but also your experience in working with people who've had some real challenges through their life. And I'd like to pose a question first to Claire, Lydia, and Sharon. Just to set the scene, how does declining estrogen affect a woman's physiological needs during and after menopause? So starting with you, Claire.
Yeah, well, I think that there's a lot to that, so I'll try and keep it simple. I think we grow up believing or assuming that estrogen is all related to our ovaries, and I think we have a limited understanding that it's actually systemic and it has an impact right the way through our body. When we come to menopause, we tend to think, well, many of us tend to think about what's happening on the outside with the wrinkles and the weight gain and the grey hair. But really, what's happening physiologically inside is really the important stuff. And what we didn't necessarily learn was that almost all our organs and tissues are impacted by estrogen, which regulates many processes such as our bone density, our heart health, our metabolism, how we utilize insulin and manage blood sugar, our brain, inflammation, and so on. So this systemic change that occurs during perimenopause and menopause, I guess, really increases the risk of many serious health problems and can be a catalyst to the start of many chronic diseases and inflammation. So if we haven't prioritized our health and wellness prior to these physiological changes, then we'll notice potentially having some adverse health effects. And so it's really a time to be aware of that changing physiology.
Thanks, Claire. Lydia, what have you got to add to that?
Oh, yes. I mean, that was a really good introduction. And it's no surprise that when we go through perimenopause and the menopause transition, that we experience such a variety of different symptoms. Particularly, I think, with respect to our neurological system. And I really enjoy Dr. Lisa Mosconi. She is a neuroscientist with a special interest in menopause and the brain. And I love what she says, particularly about what happens to the brain during menopause. She says it's a renovation project. And it gives me a lot of hope because we do adapt. That's the good news, that our bodies do adapt to this new normal, and our brains rewire. So whatever you're going through now, know that things will subside as your body does adapt.
Thanks, Lydia. And Sharon, what have you got to add?
Yeah, I think for me, one of the things that stands out, and this is obviously with that PT hat on, is kind of 4 or 5 things which I've seen women begin to struggle with, which they weren't struggling with prior to entering that menopause transition. So my kind of top 5 really, obviously, Claire's already mentioned one there about bone health. So obviously estrogen plays a crucial role in maintaining that bone density. So this really, to kind of avoid that risk of osteoporosis, we really need to start thinking when we're exercising about, are we doing weight-bearing exercises to stimulate that bone growth? So that's going to change maybe how we've been exercising. Alongside that, we know that estrogen is also linked to heart disease. So now we need to start thinking about, well, this is going to affect how we do our cardio exercise. And we want to keep our heart healthy. And we need to obviously take that into consideration. So it starts to build this picture of something that might look a bit different. Or when I often hear women say, oh, things I've been doing just don't seem to be working anymore. And not being able to get to the bottom of that. So it can be, as Claire mentioned, our metabolism and weight gain is really common. And that's super frustrating if someone's, been turning up to the gym and they're doing what they've been doing for years, and all of a sudden something's not going as it should, or why am I getting this, kind of around my midsection, I've now got this roll that wasn't there before. Yeah. It's kind of really demotivating. And of course, we notice our muscles, they don't retain in the way that they did before. We might feel weaker all of a sudden for without doing anything particularly different. So I think all of those things added together, really start to build this picture that I like to say, like, menopause is almost like being in a last chance corral. It's like, this is your chance, you've got to get it right now, because it probably isn't going to get better from here. This is about us really pushing in and seeing if we can, it's never too late, right? But there is a point where you have to go, okay, now I really, we've had a good time so far. Now I need to really think about how I'm going to do my self-care better with fitness. So yeah, I think those things for me are what I see when I'm working with clients.
Thanks, Sharon. And I love the way that story unfolds between the three of you. Claire talking about what are you doing in the lead up to menopause and the fact that it's going to affect every part of your body, and Lydia talking about all of the neurological changes that are coming up, and Sharon talking about where to from here and how do we need to adapt. And Lydia, I love that you said that we can adapt. We absolutely can adapt and rewire. And I think that's an important point, because a lot of women think, oh, is this it? Am I getting dementia? Is it just going to go downhill? But as Sharon points out, we have a choice, right? We're at a crossroads, and it's important that we make good decisions for ourselves. So leading into our next question, and this is for Claire, Lisa, Sharon, and Youna. What do you think is the biggest challenge we face at the moment in terms of nutrition, exercise, and lifestyle information for women going through the menopause transition? Claire?
Well, I think it is a huge, choosing one of the biggest challenges is a challenge in itself, because there are so many challenges. So I'll stick with one and hope that the other girls pick up on the other stuff. But I think for me, the biggest challenge is we've gone from almost no information to being bombarded with a lot of noise and a lot of information that's confusing. Some of that is misinformation. It's coming from a range of different sources. Some are health professional sources with a particular perspective. Some are non-health professional perspectives, which are maybe valid, but we're not sure of the evidence base. And I think one of the biggest challenges is there's a lack of evidence base around some of the claims in the space of nutrition, exercise, lifestyle, behaviours. And there's also that information is not joined up. So even I come from a medical nursing background, and depending on who I'm speaking to in an MDT, whether that be an endocrinologist, an oncologist, a traditional GP, or a lifestyle medicine GP, they may all have a different perspective on what's best to manage, to support women through menopause. And I think that that's really challenging, because in the social media space, we may hear that it's a one size fits all, which as a cancer nurse, it absolutely isn't. And we're all individual no matter what we present with. But equally, there's this confusion and this tension between a one size fits all model, and everybody's got a different opinion at the other end of the spectrum. And I think there's a lack of middle ground. And that to me is the biggest challenge.
It's a big issue for sure. Thank you, Claire. Lisa, what have you got to add to that?
Well, Claire, that was top of my list, so big tick to you. And I think just to add to that, I've got another point I wanted to make, but it's also very conflicting. So a lot of women sort of hear a whole lot of things as far as information, and then it leads to inaction because they just get so confused as to which way that they're going to go. But I think also it's such a big one also is the cultural and societal norms that have played a role before where we find ourselves today. So you combine that with the lack of understanding, and then those cultural and societal norms also impact the support that women get for menopause. And, that they really do downplay or ignore the challenges around menopause. You'll be right, just push through it. So that's a huge challenge for women to be able to say no, actually, I want to look after myself. I need to do the self-care. I need to take the steps now more than ever in my life to make sure that I've got all the information as it relates to the medical or the lifestyle side and information around menopause. And I think that's a really big one.
And part of that taboo comes from other women, doesn't it? Part of that stigma.
Absolutely.
I made it through.
Yeah, you can do it. I got there.
Or what's wrong with you?
Yeah, that's right. Yeah.
Tough. Yeah. Thanks, Lisa. Sharon.
Yeah, I really love that point that we've kind of made before there about almost like this trail of breadcrumbs, right, of information. A woman's picking up something on social media, she's picking up something in the magazine that she picks up in the dentist waiting, area. She's got something that's on the 6 o'clock news, and it's kind of like it's just piecemeal. And I think that adds to that confusion. And I think that for me leads to this other place of thinking, what is this lack of personalization? So I'm thinking specifically, obviously, with my exercise hat on here, but, general advice, while it can be great and it can be a starting point, the variation for individuals is huge. There are so many considerations. We might have a woman who thinks, yeah, great, I'm now going to go and lift heavy things because that's what they're telling me, and doesn't take into consideration, I've got this really weak pelvic floor. That is potentially a disaster waiting to happen. So I think it's great that we have raised awareness, that we've got this conversation going, and that there is good information out there. But I think there's more room for us to help women to get access to personalised lifestyle care. I think that would be incredible. Like, if there was something we could do in our generation, if it was to get that kind of personalised care for each individual woman, that would be amazing.
It would, absolutely. I agree, Sharon. That's the next level of innovation that's coming, I think, hopefully. Yeah. And Youna.
Well, my colleagues have covered most of those bases. I think obviously the raft of confusing information, the lack of personalisation and understanding that every woman is unique. I mean, those present real challenges for women. And for us as well as coaches to support women, you know, understanding what they know, what they don't know, where the gaps are, where the research might be lacking. So we might not be able to fill those gaps yet because the research isn't there. But I guess one thing I wanted to raise was also the language that we use around menopause, because language really matters, how we talk about this phase in life. You know, there's a lot of talking about how it's a negative experience, and without taking away from those women who are struggling during menopause, I think, you know, if we compared it to young women going through puberty, if we talked about puberty the same way we talk about menopause sometimes, they would have the fear of God put into them. And so I think, you know, making sure that there's also a positive light in this phase of life. And I think, Lydia, you talked about Lisa Mosconi's talking about a renovation. And I think that's a really positive way to look at it. It's a transition, it's a change, but there's something new and potentially exciting on the other side of it. So I think the words we use when we talk about menopause and, you know, the research and the challenges and all of that stuff is really important.
Yeah, it's such a great point, Youna, that we need to understand the challenges, but also to not turn it into a doomsday event, because nobody's going to want to engage with that, right?
That's right.
I think something else that comes out of this for me too is that when I've run a workshop recently with some fairly senior people in organisations, and I said, where do you get your information on menopause? And they all said friends. And we know that many of our health professionals haven't been educated on the specific needs of menopausal women, and perhaps that's broken some trust for those women. And where do they turn with this glut of information? And who knows how good quality the information is that you can get from your friend. They might be talking about their own experience, but what else is being shared? So I wonder how we bridge that gap and get people to start looking in the right places for information too. I guess we could keep talking about that, but I've got other questions for you all. And the next ones are for Lisa and Youna. What do you think are the most significant challenges facing women during menopause in terms of making lifestyle behaviour change, or in terms of the behaviours that they have? Lisa?
Yeah, consistency comes to mind with this. It's around creating consistency around the lifestyle behaviours. So, you know, maintaining some consistency around exercise or movement becomes, you know, a little bit harder for women. Managing stress is also a significant challenge. And I often say that you can be doing all the most wonderful things from the different aspects, but stress trumps everything. So your best intentions are sometimes not even recognised by the body because stress just seems to hijack it. And, you know, we know about adhering to a balanced diet, or, you know, or a way of eating that is supportive to you at this time of life. So, you know, all these hormonal fluctuations are happening. We've got life demands, and therein is another issue because we've got different life demands like caring for aging parents, and even our children might be getting older. I know mine are, but they still take a lot of my time. Yeah. So, you know, they are really significant challenges to those lifestyle behaviours that we know that women do want to implement and learn and educate themselves around, but there's so much noise outside of that circle bit that they want to be in the inner circle, but there's a lot of stuff outside that circle that is really impacting them. And, you know, I haven't mentioned sleep, so you might want to bring that one up.
Well, you've touched on a lot of things that do impact sleep. I mean, a lot of women, you know, do complain about sleep disruption during, you know, those perimenopause and menopausal years. And that's a big issue. I mean, if you don't sleep well, you make poor decisions around food, you don't have the energy to exercise, and all of those kind of lifestyle strategies tend to go out the window because you're just too tired. And the problem with that is that self-perpetuating, right? The more you stress about the fact that you can't get to the gym or you can't eat properly, the more it impacts your sleep, and it's just a perpetual cycle. So that's, you know, it's all interconnected. I also think there's a lot around cultural expectations of women and our you know, our duties to be all these things, to be achieving at work, to be looking after our families, to be caring for our parents. And, you know, the challenge of self-care in that environment is a really tangible one. I mean, a lot of us really struggle, even if you know, realistically you could carve out time for yourself and do it. It's a real psychological shift for many of us after having spent so many years caring and worrying about other people's needs, to suddenly realise that you have to put your own needs first. It can be really challenging, and I think I am hopeful that, you know, my daughter and generations beyond will have a better understanding of what's to come, and that they will put those measures in place a lot sooner in their lives than perhaps I did. You know, a lot of us give a lot away in our 20s and 30s, and then we hit our 40s, and we know we have to change those things, but it's never that easy. There's something's got to give along the way, and that's a real challenge.
Can I add to that too, that the world's not going to fall apart if we decide to take those little steps forward, that things will still go on. I think, you know, we're just a little bit afraid that the routine that we've established might go a bit skew-if. But as coaches, obviously, we encourage our clients to, you know, that step-by-step philosophy of just doing one thing and see how that makes you feel and then move on to the next one. You don't have to do everything or change everything to get those lifestyle behaviours going at the one time.
It's such a good point, Lisa. Break it down and make it less overwhelming. Sure. Thank you. Yeah, it is a really busy time of life. I was having a conversation with a client yesterday, and we talked about the evolution of the mindset. It's almost like you could do an evolution diagram of caring what everybody thinks about me, and then across to not giving any Fs. I think as you have diminishing time and energy, you start to go, okay, I'm getting rid of everything that's toxic, that's annoying, that's frustrating. And you kind of develop this exoskeleton. Say, right, boundaries. I'm not doing this. You're out of my life. I've got no time for that. And perhaps that makes that journey easier, and we can definitely help people make those mental shifts too. It's an important part of the change. Lydia, going to you now. We've talked about some of the challenges, but thinking about solutions, and I know that the top two things that women Google when they are going through menopause in terms of lifestyle changes are exercise and nutrition. Can you tell us if there's any dietary evidence behind dietary changes to help women to manage common menopausal symptoms like hot flashes and night sweats, those sorts of things?
Yeah, sure. I think in general, if we can have a dietary pattern or that's going to reduce inflammation, improve our insulin sensitivity, support a healthy weight, preserve muscle mass, and support our gut microbiome, then we're doing pretty well in terms of mitigating those effects of the low estrogen that we spoke about earlier. So what is the evidence? Well, very large trials have actually shown that women who eat a diet that's very high in fruits and vegetables will actually have lower odds of hot flashes and night sweats. And that is actually independent of weight loss. But then when you add the weight loss that happens with a diet that is high in fruits and vegetables, you get those odds actually increase even more, which is very interesting. And then I would like to mention perhaps three particular foods that I think women do need to pay attention to. And the one is soy foods. So soy foods contain isoflavones, and these have weak estrogen-like effects in the body. And the evidence is mixed, but clinical trials have shown that women who eat regularly have soy foods in their diet do tend to have or do tend to complain of of fewer hot flashes. And I say the evidence is mixed because it does seem to depend on the quality of the gut microbiome and whether you are able to actually convert those isoflavones into the active metabolites. So it's not going to work in the same way for everyone. But I think that including soya foods in your diet, irrespective of whether they're going to help you with hot flashes or not, is actually really important, because we do know that soy improves or helps with cholesterol, and it also protects your bone as well.
Mm-hmm.
And then the other two foods that I think we need to be cognizant of are calcium-rich foods, of course, for bone health. And we don't only have to be getting calcium from our dairy products. Remember beans and greens, an easy way to remember it. You can also get lots of calcium from your leafy greens and your legumes. And then also from small fish, sardines, mackerel. When you're eating the small bones that come in those small fish as well, you'll be getting calcium. And then the last nutrient I think that is important is omega-3s. Really important for our brain health. I said earlier, spoke about the fact that our brains do adapt, but we can certainly help that process along by ensuring that we're feeding the brain with omega-3s. And where do you get them from? Again, oily fish, but also don't forget your plant-based sources like chia seeds and walnuts and flax seeds. Yeah. So I would say those are the most important foods to include in your diet.
Great. So that's omega-3s, calcium, and the first one.
And soy foods.
Soy foods, soy isoflavones.
That's
Yes.
right. And then lots of fruit and vegetables.
Sounds tasty. And I guess people might be thinking about soy foods and what are they? Is edamame considered in that, and miso soup and all of those things too?
Yes, right. Tofu, tempeh, edamame, miso, yeah. And I would go for fermented soya foods in particular, as unprocessed as possible. Yeah, and if you're eating tofu, make sure that it's fortified with calcium. That adds to your calcium intake.
Okay, that's good to know. Thanks, Lydia. Let's now talk about some of the misconceptions that women have about nutrition and exercise in menopause. And I've got Lisa and Lydia to speak about this. I might start with Lisa this time, if that's okay, and then go back to Lydia.
Look, I think there is a misconception there. I know we've talked a little bit about weight gain, but that it's going to be inevitable. And also that extreme diets and exercises are what we need to do to remain healthy. And I feel like we couldn't be more far away from that, actually. And I think that changes, we do obviously experience changes in body composition. That they happen, but they can be managed with the right lifestyle adjustments. And again, it all comes back to education around women arming themselves with the necessary education around what that means and what that looks like. And I also feel like that and Sharon may want to talk about this a little bit more, but I feel like there's a real common misconception out there that cardio is the best or the only exercise for weight management, which is probably what we've been doing the last, from our 20s to our mid-30s, but it changes. The way we exercise and the way we move does change in this part of our life. And, things like resistance training becomes really crucial, and some weight-bearing training also becomes crucial for maintaining that muscle mass and that metabolic health during menopause. But also want to encourage women. We hear about strength training and resistance training and all that kind of stuff, but don't forget about doing the movement that you love. So if you love going for a bike ride or going for a walk, and having that connection with your friends and just, or just do what I do, or put my ear pods in and I just walk and I listen. That's how I get my podcast listened to. So don't think, but do something that you love combined with some of the things that are being recommended, or the types of movement that's being recommended to have a positive lifestyle and also help with that weight as well. And I think nutrition, I think that Lydia has really covered that off beautifully in that last question.
Thanks, Lisa. Lydia, have you got anything to add?
Yes, I'd like to mention one misconception that I come up against a lot, and that's protein. Many of my patients and clients will say to me, will ask the question, am I getting enough protein? And I think that unfortunately we've put protein up on a pedestal. And I want everybody to know, or to realize, that any macronutrient in excess is going to be turned into fat. Too many carbohydrates, too much fat, and too much protein will, if not used by the body, will be turned into fat. So more is not always better. And also I'd like to mention that we have to also remember that food comes in packages. So protein is not just protein, it comes in a package. And we have to think about that entire package and how good that is for us. And so I'm going to talk about the difference here between plant-based proteins and animal-based proteins. When you eat protein that comes within the plant, you're getting lots and lots of fiber, which, as we know, is so important for the gut microbiome. We're getting the phytochemicals and all the antioxidants that we need that are going to reduce inflammation. When we take the protein in as the form of animal protein, we're not getting any fiber, and we're getting a whole lot of saturated fat and cholesterol, which we know is going to increase our risk of heart disease as we age, and possibly also dementia. So we need to be aware of that. There are a lot of misconceptions. People will say, well, we need to make sure that we're getting good quality protein, or that we're getting all of the essential amino acids. And believe me, you will get all of the essential amino acids from a wide variety of plant proteins. And by that, I'm talking about legumes and whole grains and nuts and seeds. If you're covering all of those bases, you will be getting all the amino acids you need. You just have to look at the animals who don't eat meat. Where do they get their protein from? Where do cows get their protein from? And we know that there are so many examples of super athletes, having just come away from the Olympics. Many of those super athletes would be eating 100% plant-based diets and doing very well. So that's just something to bear in mind. Yes, protein is important. I'm not saying it isn't, but we don't have to be worried that we're going to have a protein deficiency. It's unheard of, in Australia, in industrialized countries, for people to suffer from protein deficiencies.
It's more about the quality of the protein that's important.
Yes, and remember, the entire package is what we're talking about when we talk about quality.
Thanks, Lydia. Some great points raised there. And I guess another area that people might be thinking about or wondering about is alcohol. And it's difficult when you're in midlife, you're stressed, you've got a lot going on. And I once said to a room full of teachers, what's the first thing you do when you get home? You walk in the door and they all yelled out, grab a glass of wine. And they laughed. But many of them were struggling with health issues. And so I'd like to ask, maybe starting with Youna this time, because Youna, you've always been at the end of these discussions, and then we'll go to Claire. How does alcohol consumption affect menopause symptoms and overall health?
Well, certainly from a sleep perspective, and given that a lot of women in perimenopause and menopause suffer from sleep issues, alcohol does have a role to play in that disruption. Clearly, a lot of women turn to alcohol as a way to calm down at the end of the day and perhaps help them actually get to sleep. A couple of glasses of wine, they feel a little bit, more relaxed. They go off to bed and they fall asleep quite quickly. But we do know that alcohol actually represses REM sleep, which is that rapid eye movement phase of sleep, which is associated with dreaming. Mm-hmm. And REM sleep tends to happen in the second half of the night when you sleep. And what happens if you drink alcohol is that you may have a very deep slumber. It's not really a slumber because you're under the effects of alcohol, but the first half of the night, you'll sleep without any wakenings, and then you'll wake up at 2 or 3 in the morning, and you'll have a very fragmented sleep as a consequence of that alcohol intake. And that's when you're missing out on that really important REM sleep. REM sleep's been associated with, strengthening neural pathways, consolidating memory. And when we look at it in the context of aging, puts us at risk of dementia. And if anyone has had parents who have lived with dementia, and, I've got quite a number of family members who have gone down that path, it really does make you rethink, is that glass of wine worth it? And it comes back to that discussion about, we're at a crossroads right now. Can we make better choices for our future aging selves? And is that glass of wine worth it in that context? And clearly there's other impacts of wine, and I'll let Claire touch on those, but certainly from a sleep perspective, it does have a negative impact. The other thing is around risk of sleep apnea. We do know that when women approach menopause and postmenopausal women, the risk of sleep apnea increases, and in fact reaches levels equal to their male counterparts. And we know that alcohol is a major risk factor in sleep apnea, and that comes with all the other comorbidities associated with sleep apnea, cardiovascular disease, whole raft of not very nice health implications. So I think that's another, if you are prone to snoring or sleep apnea anyway, drinking a glass of wine or 2 is probably not going to help that either.
Interesting perspective on how alcohol disrupts sleep, and I like that you're thinking about not just what's going on right now, but what are the implications of the choices you're making now. It's such an important point. Claire, what have you got to add?
Yeah, I'm fascinated by, our cultural acceptance of alcohol and the knowledge we have about alcohol and its harm to our health. And that's, a whole cultural impact. But I think certainly as midlife women, and I myself, I'm very, find it very relatable to have a stressful day at work and turn to a glass of wine. That we know that it gives that dopamine effect of feeling rewarded or relaxed, but understanding that it also has a direct impact on our brain and suppresses those neurotransmitters is really important to understand, because if we're experiencing, anxiety for the first time related to perimenopause potentially, or potentially heart palpitations or hot flushes, and then the sleep and stress that Youna mentioned, then alcohol is just going to exacerbate that. So I think as we're transitioning through the menopause transition, alcohol can make that whole transition experience worse and compromise our experience. But equally, thinking about it from a broader health perspective and chronic disease perspective, there is a lot of evidence, very compelling evidence, of randomized control trials of people that drink alcohol against those who don't. And what we do know is alcohol is toxic. It's poisonous to us. It's carcinogenic. And in terms of our overall physiology, it not only affects our brain, which we all know it does, in both a positive experience but a negative impact. It also impacts our liver function. Our liver is already compromised during the menopause transition. It's less able to manage the flow of toxins coming through. And because of that, we end up with more alcohol in our bloodstream. So many women that I speak to seem to be less able to handle the alcohol they could handle in their 20s and 30s. And that's exactly why, because we end up with more alcohol in our blood. And therefore, that has a cascade effect on a number of different organs. It increases inflammation throughout our body. It impacts metabolism. We've already talked about bone health, and alcohol actually impairs calcium absorption. So that's going to have an impact on our bones. And really importantly, probably my 2 health passions, or not passions, but areas where I think we can make some really big impacts is in cancer and heart disease. And we know that there is a direct correlation between some cancers and also heart disease with an increased consumption of alcohol. So I think the message is that it's a great time to reflect on our alcohol consumption and to consider moderating it, and seeing if there are other benefits, other things we can do to reduce our stress, alternatively to the alcohol that we always used to go to.
It's such great points that you've both raised. And I remember being at university studying biology, and as part of my degree, we used to preserve things in pure ethanol. And then, I don't want to get anyone in trouble here, but people in the department would then go and harvest some ethanol for the university party on the weekend. And I think, hang on, we're taught that alcohol is a metabolic poison and we're preserving things, invertebrates, in this poison, and then we're making punch out of it at the university party on the weekend. Doesn't seem logical, does it? But we don't think about alcohol that way. We think of it as something that is a social lubricant, it's a relaxant, it's a this, it's a that, it's a pleasurable social experience. And perhaps those are the things that we need to rethink as part of our consideration of alcohol moving forward. One last question for the group, for Claire, Lisa, and Sharon, and that's, how can we advance the understanding of lifestyle interventions for women going through menopause? Claire?
I think there's a number of things we can do. Firstly, my passion, I have many passions, is to disseminate evidence-based research in meaningful ways. And Youna mentioned it at the very beginning about language. Let's get this evidence-based information into the hands of women in a way that makes sense and provides meaning. That would be my number one. My second one would be to promote quality education and information and awareness from credible evidence-based sources. I think support, and we talked about, I think Sharon and Youna both mentioned supporting a personalised approach, being really, really intentional to understand the women from an individual perspective, what is going to be important for them, because it will be different for all of us. And I think finally creating supportive and safe spaces for women to share experiences and to get accessible information that can really, really make a difference to their lifestyle.
Thank you, Claire, and we'll go over to Lisa.
I love all those, Claire, and just building on from that, I think more interaction between different fields of health. So, this is where SAGE does it so well, is bringing different modalities together so that we're providing a beautiful 360-degree element in relation to the content that we're sharing with everyone. So based on, comprehensive evidence-based best practice, all those kinds of things. And the other thing is, Claire did touch on it too, is, fostering those communities where women can share experiences. And so it might be that they've got the education, they've got the research, but coming together with other people where they feel safe to be able to discuss those is really, really important, because they impart that knowledge that they've brought from a reputable source to others. And so it makes their world bigger, not just for them, but for the people that they're sharing the information with.
That's a great point, Lisa. Thank you. And Sharon, lastly.
Yeah, I think when I was considering this, I love those points that have already been made, and just kind of building, I guess, on that idea, I guess more around this sort of personalization. Obviously, we can think of that as the individual woman and, personalizing things for her. But that can only be done if those who are running those programs, or, the trainer in the gym, if they understand what's required, if they actually have knowledge of menopause as a special population of people. And so I think part of this is about educating healthcare practitioners. I know when I trained as a PT, we didn't mention late menopause. And I also quite recently was sat with some girlfriends catching up, and one had decided that for date night, her and her husband had hired a PT and they were, this was going to be their date night. So they're doing this workout together. This is a young PT who's great, no qualms with the PT. Husband ends up like feeling great about it. Wife's like, oh, I was aching everywhere. My shoulder was hurting, my knee was hurting. And she said, I just don't understand. I don't understand what was different. And I think that's a perfect example of what we mean by PT was great, doing exactly what the PT has been trained to do, but doesn't understand that something has changed biologically for this person, and therefore they need a different approach. So I think there needs to perhaps be guidelines around there. That would be a real win if we had some guidelines, if we could get those into the public domain, if we could raise awareness for the general public. We would also create demand so that when you went into a gym, you would be asking for a person who was specialised with this knowledge. And obviously that would be safer for everyone too. So yeah, I think those things. I think let's try and up the game for healthcare professionals, especially people in gyms, and raise the awareness in public where other people can understand, yeah, this is important. This is no one's fault. This is just a biological phase of life. And we deserve the best. We deserve those programs. We deserve things that are going to support us as we make this choice, make good choices to move forward.
Thank you, Sharon. I hear the passion in your voice as you talk about that. I think that's a great place to close. I was thinking about what's the number one way we make a substantial difference, but really I think we've answered that. There are many elements that we've talked about today, from getting the right information into the hands of people to supporting health professionals to understand what they can do, and also talking about individualization and helping women with support through this challenging time of life. There are so many things we've discussed, and hopefully we've kind of cleared a few things up around nutrition and exercise for people that aren't sure what to do and aren't sure where to go. I'm hoping this becomes a resource, plus leading into something that we'll be releasing very soon, which is pretty exciting. More to come on that. Thank you, Lydia, Claire, Lisa, Sharon, and Youna for being with us today, for sharing your expertise and knowledge, and look forward to seeing you soon. Thanks, everyone.
Thanks, Mel.
Thanks,
Thank
Mel.
you.